Someone's got to tell them we can't hear.
Good evening, everyone. I'm Ronnie Towell. I'm an honorary member of the Board of Directors of Sephardic SPH. I'm also co-chair of the Mental Health Resource Division, MHR, along with Rena Asher, who's my co-chair. In fact, Rena tonight is responsible for most of the work that came into getting this program together this evening. So I wish Rena very well. This tonight's session is done in memory of Rena's dad, who passed away this past week. Mara Set, a wonderful, wonderful person, Moshe Ben Meina. And also tonight's session is also for the Refuah Shlema of Yitzhak Ben Hanon Hana, is that the Shem, that Refuah Shlema. As with every other challenge that the world around us has to grapple with, our community isn't immune to mental health challenges. Whether it be young or old, children, teenagers, young adults, singles, married couples, or seniors, literally everyone, somehow everyone is impacted. In the past, no one spoke about it. There was a stigma attached. That stigma prevented community members from seeking advice, guidance, and help in discovering ways to lead a fulfilling life. Mental health resources at SPH has three main goals. One, mental health awareness. Two, programs that both community-wide and our yeshivot. Tonight's program is one of the many that we had already, and one of the many that we plan to develop over the next few months. Referrals. Last year, we provided more than 1,800 referrals by utilizing our database of more than 1,000 well-vetted private clinicians. We have two very special guests this evening, Rabbi Joey Haber and Dr. David Barrow. Rabbi Joey Haber is a very well-known rabbi and lecturer in our community and beyond. Dr. David Barrow is a psychiatrist who is certified by the American Board of Psychiatry and Neurology. We'll now have the benefit of sitting in on a conversation between the rabbi and the doctor on the topic of mental health. I'll turn it over to the rabbi.
Thank you, Ronnie, very much. And it's very much an honor to be here tonight. And I want to start by saying I'm somewhat out of my league in being here. This is not a matter that it's a topic that I care about very, very much, very much. And because we love and care about the community, we care about it very much. But the reality is I'm not an expert and I don't claim to be. Which is why I want to start with the first question for the doctors, that I'm going to learn some things from you tonight. And I hope that together we can inspire people to be more motivated to address the topic when they need to. So here's question number one. What mental health issues are most prevalent in today's day and age? And what's the biggest challenge right now that our community is facing?
Okay, so I hope we have enough time. It's a large question. And it's also an honor for me to be here just to help to try to serve the community, people that we all care about a great deal. So I'll tell you, I think really what we need to do before we get to the community, we should just talk a moment about the lifetime incidence of a lot of mental health conditions. Okay, the numbers that I found in this nation, in the US. So we'll start with the ones that are a little bit less common and then proceed from there. So if we start with some of the most severe conditions, for example, schizophrenia.
Okay.
So that affects about 1% of the population. That means 1 in 100 people in the population
Have schizophrenia.
have schizophrenia. Various forms of it, maybe more than you think. That means when you're sitting in shul, there's a couple of people there, 2 or 3, that have that condition. The incidence of bipolar disorder and OCD, 2% of the population. 1 in 50 people will carry that diagnosis.
Bipolar and OCD are the same thing,
2 different conditions.
but they together.
They just happen to have the same overall lifetime incidence.
Okay.
They each separate, completely separate diagnoses. We're not going to go into the intricacies of each diagnosis.
Fair.
That could be maybe for another time. Bipolar is 1 out of 50 people, and OCD is 1 out of 50 people. Each could be extremely severe or less. The likelihood that someone in their lifetime will sometime at one time experience an episode of major depression is 1 out of 7 people. That means somewhere in a person's life, when they're young to they're old, 1 out of 7 people will go through an episode of major depression. That doesn't just mean being sad. That's a clinical term with tons of functional impairment and a lot of criteria that go along with it. 1 out of 7 women, somewhere in their life, childbearing women, will go through postpartum depression. I'm not talking about postpartum blues. That's even way, way more common. Postpartum depression, clinical depression, which can be disabling, depression and anxiety, 1 out of 7 women. 1 out of 4 people, sometime in their life, will go through at least one episode of what can be termed as clinical anxiety. That includes all the anxiety diagnoses, generalized anxiety disorder, panic disorder, various phobias. 1 out of 4 people, 1 out of 10 people will be diagnosed with various forms of ADHD. So these are the numbers.
So if I'm doing the quick math, before we even get to the ADHD, between the schizophrenia, OCD, bipolar, anxiety, depression, and then postpartum, you're talking about approximately 50% of people. I say one is 20 out of 100, or it's 13 out of 100. The other one's 13 out of 100. The other one's 4 out of 100. The other one's 1 out of 25 out of 100. You add over 50% of people.
Right. So those are the numbers in the country. Those have been the numbers consistently for the past 30 plus years. They haven't changed much.
Right.
Various fluctuations. And unfortunately, our community does not escape these numbers. These are the
Are
same
our numbers similar?
They are similar. It plays out the same way. So what that means is
Every other guy I meet might have a
either
problem.
you yourself or someone in your immediate family at some point in life will go through a mental health disorder, a clinical disorder that can be diagnosed by the DSM-5, a Diagnostic and Statistical Manual of Psychiatric Disorders. Somewhere in their life will happen to them. So it's pretty much called being human. It will happen to you or someone very, very close to you that you know intimately. Now, you ask me, what am I seeing, right? That's our community for the last number of years. Recently, there were a few other things that really stand out and I'm seeing more and more of in my day-to-day practice. First of all, just to touch on the past 2 years of the COVID era. Okay, so definitely seeing tons more anxiety and depression. And people have gone through a lot, whether it's losing loved ones, losing businesses. So much unknown. Life has become completely unpredictable. Even the simple things we used to take for granted, planning a vacation. Do I do it? Do I not do it? Am I scheduled? How many of us scheduled and booked, unbooked, insurance covers, insurance, just tons of unpredictability. And it's bred a lot of fear and anxiety among people.
So all the numbers you said are all pre-COVID.
Pre-COVID.
Post-COVID, you feel like some of those numbers go out the way.
Those are the numbers I've been treating patients for close to 20 years. Those are the numbers that have been consistent. They really do add up that way. Now, recently, again, these are more challenges that have spiked. So there's the COVID era, which brings with it all of the distress and fear and uncertainty and loss and sadness. The other thing that really jumps out when I think about what our community is challenged with, it's the extent of substance abuse, drugs and alcohol. And it's gotten very, very frightening over the last 8 to 10 years because the things that are sold in the streets have become more prevalent and accessible than ever. For example, if you look at, before 2010, 10 years before, and then afterwards, the prevalence of opiate abuse, of heroin abuse skyrocketed. It was plateaued for about 25 to 30 years.
Why are you bringing that up in regards to mental health?
Because this is what I see. Our community, good guys in the community.
I said, but are you saying it's a product of mental health challenges?
Absolutely. Substance abuse, anything that impacts life in a negative way in general, okay, in a psychosocial form, that all falls under the category of mental health, okay? And certainly substance abuse addiction impacts every aspect of a person's life, their entire family,
Right.
their children, everything. They lose their jobs, lose their businesses, they lose their lives. And the distress that comes with it, the various emotions, depression, anxiety, anger, the fear that comes along with it. I see that all the
Right.
time.
So to your point, I just from the pandemic, even on a small level, like I had COVID 2 weeks ago, and by the end of the week, I was only had to be home 5 days. By the end of the week, I found myself edgier.
Yeah.
And then my daughter had COVID the week after, and I realized she was edgier. And then someone sent me an email that was kind of not appropriate. Not appropriate, but a little disrespectful. And then I saw the person there. I said, "No, I'm sorry, Rabbi. I was just edgy because I had COVID." So you're finding everyone, even if it's not diagnosable, everyone is more of an edge because of everything. There's more of an edge because everything seems to be because like you said, everything is unknown, and because of all that.
So because you've been edgy, I'll try to speak to you a little calmer. I don't want to, incite any edginess. I'll be very careful. Thanks for the warning. I got that little message there. Thank you. I appreciate that. I've learned to read through the lines and start the lines myself.
Oh no, I didn't sign up for therapy.
Yeah.
That's not what I agreed.
I can't help myself. I'm sorry. One thing I didn't mention through COVID is that there's a much higher incidence, just seems to be from COVID itself, of anxiety and depression, a little bit higher in women than men, actually reducing even people who've never had it before, a new onset of anxiety and depression. COVID seems from the virus itself.
Oh, the virus itself creates something.
That's correct.
Not just the side effects of being home and
Correct.
quarantine.
People who have never, even if their life hasn't changed dramatically, it leads to, whether it's from an inflammation standpoint, the immune response, there could be many theories, but it's definitely a higher incidence.
So in essence, to wrap this question up, in other words, what you're saying is that this is one of the biggest challenges that we're facing today.
Yeah.
And the side effects from that, of how it affects a kid in school, a person in business, a marriage, parents, is endless, I'm sure.
Yeah. There's one other point that I just have to bring up, okay? Because the thing that actually concerns me the most, the trend that I'm seeing, the under 10 years, the last 5 to 7 years, is the high incidence of anxiety and depression in our adolescents, specifically high school age children. Okay, like I said, I'm doing this for close to 20 years. It's skyrocketing.
Because of social media?
I think, well, listen, our children they're under assault by society. So I think multimedia, social media is probably the biggest challenge, because we have no ability to protect our children anymore.
Right.
And they're just not ready for it.
Right.
When I was a kid, my parents were so careful, don't let them hear, don't let them slightest things. Now kids are being rocked. They're not ready.
Right.
And there's no way to shield them.
It's not just social media, it's media.
It's impacting them in incredible ways. That's really what last several years, that's the thing that I'm really concerned about.
Because it's only going to get more and more intense and more.
It's gotten very intense.
Right. That's because no one's sitting and watching a video on their phone that just says, "Oh, President Biden may be good, may not be good." Instead, they're saying the world's coming to an end, and Trump, the world's coming to an end. So there's always world coming to an end. Media, watch it.
Constant. It's impacting adults, and it's impacting the kids more. They're not ready for it. They're afraid. They're depressed. They feel hopeless.
Right.
It's something that has to be addressed as we move forward. I don't know what the answer is. It's not going to be an easy answer, but if we're going to help the kids, that's going to be part of it.
Right.
So I'll tell you. So I have a question for you, Rabbi.
Okay.
That's okay, because now, this next question I see that they got here for me. This is, I think, the $60,000 question over here. It says, within the community, there's a lot of stigma around therapy and treatment. How do you avoid stigma of getting help? Any advice to give?
Stigma about the treatment. So I hope that, so let's start. I think the stigma is based in old school thinking. And the old school thinking is in part some belief or thought that, like, we're not supposed to care about this, or it's not supposed to matter that much, or the Torah doesn't care about it, or it's not so important to get over it. Maybe people 100 years ago or 50 years ago were able to get over it faster and just man up, so to speak. I don't know if that's true or not. But right now, to me, what's happening as a result of people not dealing with it is that then their life is all of a sudden more and more and more affected. So if you're afraid of a stigma, the first thing you need to ask yourself is, what happens if I don't get help? Oh, I'm gonna be fine. I'm gonna be fine. I got this. I just was in a bad mood yesterday. I got this. No, it's not true. The reality is that if you ask anyone, these issues, if a person has an anxiety issue when they're 10 or 12 or 15, life gets more challenging, not less. Raise your hand as an adult, not in the room. Raise your hand as an adult who says, when I became 30 years old, everything relaxed. That doesn't happen. So if you have a challenge when you're young, it's going to get worse. So I think the first thing you need to realize is that the idea of only worse than getting help is not getting help. And then number two is that I think you need to realize what's the stigma. So you're going to tell 4 people looking, your parent, the therapist, your mother, your father, and the therapist. It doesn't have to be 500 people don't have to know. So a person can go for therapy in a way that it's relatively private and therefore not as big a deal as they might think of. And I think number 3, I'm trying to say 3 points. I think number 3 is the fact that the stigma is not as much there as they used to think. Everyone, like we just said, everyone's going. I don't want to say everyone's going to therapy and make it like, just when you have ego and Tony go for therapy. But there's a lot of people that are upstanding, successful, productive people that are going for therapy. So I think you need to realize those 3 things. First of all, not everyone needs to know. Second of all, the only worse than not getting help, is not getting help. And then finally, the fact that the stigma is not what it used to be. And I think a parent's responsibility, if they realize in their children that the child is hesitant, is to break the stigma. The parent has to make sure, and I've had people tell me that I could never tell my parents that. What does that mean? You're in a situation, let's say you're a victim of something, or you're in a situation of when you're having an emotional disorder, and you can't tell your parents? I want to, every parent, raise your hand if you're a parent that your kids can't talk to you and your kids don't feel comfortable to say, Ma, I have a problem, or Dad, I have something on my mind, then you need to change something. Spend more time with them. Take your daughter out for dinner. Do things, zone into your kids. Put down the dumb phone. Put down the phone so when your kid sees you, they're talking to you and they feel like they have your presence and that they feel like they could say things. And don't judge them if they have a challenge.
So people are embarrassed. People are embarrassed to speak up. They feel weak.
But start with your family. Start with your parents. Start with a sibling that you're close to. And parents have a responsibility to make sure that their kids feel comfortable to speak up. And then the parent has to have the guts to say, we're not announcing it on Ocean Avenue or Ocean Parkway. We're just going to call a therapist. And we're going to see what he can do. And if that therapist doesn't work out, we'll send him.
So I agree with what you're saying completely. I really do. But I think it goes even a little bit further. The fact of the matter is, stigma is that it's a big facade. It's a big facade. Nobody talks about it. But the amount of people that go through it, it's literally every 3rd person around you.
So the stigma is gone. I don't know, 100 years ago, not so many people went to therapy.
Well, but I tell you what, because 100 years ago, psychiatry and therapy was very, very different. If you were seeing a psychiatrist just over 40 years ago, you must be crazy.
Right.
Because the treatments that they had were very, very heavy. They were effective, but there were tons of side effects. You're drooling outside of here, you're sleeping over here. The whole world's changed the last 30 years. The entire field has changed. The treatments are mild, they're benign. The vast majority.
One thing, I think you're bringing up a very important point that I'm not sure people realize, that the stigma is based on a different type of medicine or a different type of treatment. The treatment, it's like you're comparing football to baseball, where the treatment in the old days, what we would have called mental health or psychiatry, was intense for someone who had a almost non-functional type issue. And nowadays, psychology and psychiatry is addressing normal people that are living normal lives, just making their lives smoother and healthier.
There's almost no similarity.
So
There's almost no similarity. It's the truth.
So I never realized that.
I'll be honest, even I remember in residency, I was doing a research paper on certain types of treatments and resistance to treatments and interviewing various psychiatric attendings in the hospital, why they wouldn't refer. And some of them brought the resistance for themselves was the movie One Flew Over the Cuckoo's Nest.
Wow.
In the 60s.
Wow.
Do you understand how far back it goes? How things have changed.
And you're saying that
things have changed drastically.
Wow.
They've changed drastically. And there's such resistance there. Again, the reality is the people that I see in my office, They are the most successful people of the community. They are rabbis of major kahals. They are powerhouse women who run organizations. They are therapists. They are teachers. There's an everyone in between. It's called being a human, literally. And sometimes I say, I wish I could just run a group so everyone can see. You know, they say, what, you're here? Oh, wait, I can't believe, get out of here. But people who go through it, do you know how often I hear the line that the person thinks they're the only one who goes through it? I can't, and it's heartbreaking because it can be the same exact, I see three people in a row, sometimes it's the same words that they'll be using. Totally, when they go through it, you feel like you're never gonna get out of it. You're in a dark hole and you feel so alone. And I can promise you, if you're going through it, I promise you, you're not alone. You're just not. People all around you, whatever you think you're going through, you think it's unique. Everybody has their own unique life experience, but the suffering that you may be going through, tons of us have gone through it. And it's really time just to stop, to take away the blockade. We're hurting ourselves.
It's completely based on a false idea of something that was built at a different time, but it was a different thing.
We're doing it to ourselves by not speaking about it. We just are.
That's
There's Tom, do you know, I see sometimes in my practice, I've seen 3 generations at the same time, parent, child, grandchildren, several family, none of them knew that they were coming in to see me. And I have to pretend that I have no idea what they're talking about or what they're talking about. And they would never speak about it. What are we doing? Why do you have to make life harder? It's called being human. These are difficult times. And even if, I'll tell you what else, even if a person can have a perfect life, nothing wrong. God forbid they can become morbidly depressed or come down with a certain condition, right? How could it be? I should fight through it. I should be able. Just not what it is.
I think that at times a woman or someone will come up and say, I have a challenge with my marriage. And the husband will say, and the woman, I'll say, woman, maybe you need therapy. Mom, my husband won't go. I'm like, 1 second, your marriage is a mess. So this is better. This is better not getting therapy and you can't talk to each other and your family and your kids are mad, I don't want to say messed up from it, but kids are hurt by it and they're distorted because you won't try to talk to somebody. What's therapy? It's just having a conversation with somebody. Why is that so difficult?
That's what it is. That's exactly.
It's just a conversation. So try to have a conversation. Oh, I know what they're going to say. They don't help. They do help. And they may not completely get rid of the problem completely, but they guide you, they help you, they give you, I give this concept in a class and tell me if I'm right for saying this. I said, sometimes people go to therapy and it's like they have a dog inside of them. Like it's the anxiety, OCD is like ferocious and they want to come to you and they want you just to kill the dog. And really that's not what therapy is. You're not necessarily going to kill the dog, but you're going to put the dog on a chain.
It's a process.
And when the dog's on a chain, life, and even though it may every now and then bark and may every now and then be a little scary, but having a dog on a chain and having a dog not on a chain is a completely different experience.
Yeah.
Okay, so let me get to my next question for you. Next question is like this. How to know when to get psychiatric help and who it's for? Like ages and stages. How do you know when or not? And is there such a thing as too young or too old?
Okay. So let me answer the second part first.
Okay.
So is there any, is there too young? Well, the answer is clearly not.
Right.
Depending on.
That means a 6-year-old could go?
Absolutely. And even that, sometimes less for various things.
And when you solve it at that age, could you help solve it ever?
We're not talking about right away solving it, okay? It depends on the situation. Sometimes it can be solved in a short way, depending on the situation. Sometimes you're getting the child treatment at a young age so it doesn't impair their lives.
Right.
And oldest, I think my oldest patient that I saw for the first time, it's like I was 99. So whippersnapper, yes, yeah, very sharp. So there's no age gap.
She was good when she was 97. I just want to be clear.
99, very sharp. Different things, different times, right? We're on all different things. So there's no age limitation. When it comes to children, parents have to have their eyes open. They have to be smart. And how do you know when to bring somebody in? That's a great question. So I think, first of all, the threshold should be low. If you wait till a person is falling apart in life.
Again, because why not?
So, right. If you wait till they're falling apart, so a lot of damage has been done. It takes a long time to climb out of it. You're talking about more intensive types of treatment. You can get them out of it. It takes more time, and there's a lot of anguish along the way.
And also, there's a lot of residue in their brain of
Yeah.
failure or of anxiety, depression that was there for
So
10
much.
years, 20
It
years.
takes time. There's a lot of healing that needs to be done. You catch someone when they're young and you're able to identify it. So you get into treatment early, at least get a person about an evaluation. It doesn't even necessarily mean that they begin treatment. You bring them to a professional, whether it's a psychiatrist, whether it's a therapist could be a psychologist, a social worker, a mental health counselor. Get them into treatment, let them get an evaluation and get started. So things don't impact.
Right, so I've told people, I'm telling you if you agree with this, I told groups that first try to have a conversation with your parent. And like I said before, a parent has a responsibility to have that kind of openness. And then maybe it's a conversation with a teacher or a rabbi.
Mhm.
And then from there, if you feel like it's not getting addressed, then give an evaluation a shot.
Mhm.
Okay.
I'll tell you, I love this next question because I feel like this comes up all the time. All the time. You ready for it?
Yes.
All right. So it says, during challenges, when do you use emunah bitachon versus getting treatment?
So I have a great suggestion. The next time someone finds out that they break their leg, I'd like them to stand up and tell Hatzalah, don't take me to the hospital. I'd like to stay home. I'm going to read daily emunah, your brother-in-law, and it's going to solve my
Oh,
problem.
right there. Yeah.
Okay.
Uh-huh.
Of course, emunah is a very, very critical piece to living life with peacefulness and happiness. But when there are issues that are diagnosable, that are chemical, that are even just issues that you're struggling with, there are tools. So try to build a house with emunah and no hammer. That's ridiculous. You need a hammer and you need emunah that it's going to go up and it's going to succeed. But you need the hammer to build the house. You need to go to the hospital in order to get a cast on your leg. So the same thing is that when you have an issue that you're dealing with inside, then emunah is an important piece. It's going to help you. It's going to guide you. But ultimately, it's not the tool itself. The tool itself is the healing. And just like the pasuk says, "But Hashem gives permission to doctors to heal." Just like we have physical healing, we have emotional healing. And what's the difference? So you can't just emunah ingredients into a cake. You can't emunah sticks into a house. You can't emunah your car into driving somewhere. You have to go and do it. So I think the same thing is true here. You have to have emunah, but ultimately the tools are going for therapy and sometimes medicine in order to solve the problem.
I'll tell you, I think that among the religious community at large, I mean, not just the Sephardi community, further beyond Ashkenazi, Hasidic, all that, it's one of the biggest obstacles to treatment. In other words, all the time.
But I think the reason for that is because emunah does help and bitachon does help. So anything that does help becomes an obstacle because you think it helped. The problem is on a scale of 1 to 10, your problem is a 9. The emunah helped you bring it down to an 8. You didn't solve the problem, and you really fooled yourself into thinking that you solved the problem. So again, emunah bitachon has to be clear. There are a lot of people whose lives have turned around because they have emunah bitachon and it helped them, but they need the tools.
Yeah, and the issue is that a lot of these conditions, not all of them, was a mix of things. They're biological conditions. We know more
chemical
about the biology, about the genetics, and so like I said, it's a medical condition. A person has hypertension or diabetes, use your emunah, but it's all the time people come inside, they're forced finally to come see me, and they're down on themselves. They're self-loathed. I should be able to deal with this. My emunah is lacking. One time I saw a big rabbi from the Hasidic community, who was sick, and the Hasidic community writes Sefarim. In fact, other patients come in and they quote him. But one time he became extremely depressed, right? Clinical depression, and he became non-functional. I couldn't give a shiur like that anymore, and he was very, very embarrassed to come in. And I explained to him for a while the biology behind these things, and thank God he got better. He treated with medication, got totally better, and after he got better, he gave me the line that a lot of people did. I can't believe I went through that. And I didn't understand how this can work. Biology, people said, pick yourself up.
Right.
Okay, get out of bed. What's the matter? Get your president said everything is good in your life. It completely destroyed me. And he says, nowadays, Every time I have a chance, I'm speaking to my Talmudim, I tell them, if you need help, go for it.
Wow.
Nothing wrong with it. He says, my entire perspective changed.
So let me tell you a little story. In the summer, there was an event where they were going to talk about mental health for about 40 young rabbis in the community. And there was some Gedolim there. There was Rosh Yeshiva of Palm Beach Yeshiva and Rabbi from the Mir Yeshiva of Adhd. So someone got up and said, Rabbi, you're talking about mental health. A young rabbi asked the question. He said, talking about mental health. And he was very well-meaning. I want to be clear, the young rabbi. And he's someone like doing great work for the community. But he got up and he said, I went to her, Rabbi Miller said that really the whole thing is just a Yetzer Hara, and you have to fight and overcome the Yetzer Hara. The coolest thing was to see Adhd, who might be in his 60s, 70s, maybe even older, who's this really sheepish, rabbi, gets up out of his chair, and he pretty much was screaming for 5 minutes. He looked like he was going to kill the man. What are you telling me about Rabbi Miller? You took the quote out of context. Rabbi Miller is great, but there are people that have inner issues and challenges, and you want to just tell them to fight Yetzer Hara? This is the problem. You are causing the problem. He was just flipping out of him. That thought process is causing the problem. Yes, people need to work on themselves when they have challenges in their midot, but when they have real deep issues, they need tools. So just to tell them that you fight the Yetzer Hara, and again, I don't even know what the rabbi meant that when he asked the question, the young rabbi, I don't know if he was asking the question right away. He's a good person. But Rabbi Brittany's response was so eye-opening in terms of how even the yeshiva world, the strong yeshiva world, is recognizing the extent of this and the depth of this and the point of this. So people with way more emunah than we have are realizing that when there's a challenge, whether it needs medicine or not, when there's a challenge, you need the tools. And there's no way without the tools. And your emunah is great. Obviously, you have emunah. This is going to be the right therapist that's going to get you where you need to go. You need Hashem's help to hold your hands.
Tremendously. Having the emunah strengthens the person tremendously.
But at the end of the day, you need tools. Okay, I have a question for you now.
Do you?
Yeah.
It's my turn. Okay.
I think it's mine.
Okay, go ahead.
We're both answering. Well, it's all good. Okay. Explain the difference between psychology and psychiatry. And what's the best treatment? Medicine, therapy, or both?
Okay. You have time for this? Okay, so
Make it quick.
difference between psychology and psychiatry. So I guess, just generally speaking, you can say psychology is studies of theories of the mind.
Okay.
And psychiatry is probably a study of theories of the brain. Okay, the brain and mind are two different things.
For Hazid cases like me, what's the difference?
Well,
The brain and the mind, as far as I know, are here.
when we talk about the brain,
Yeah.
we're typically talking about the physical organ,
Okay.
that runs on chemicals and cells and neurosynapses and electricity and all these things. We have billions and billions of neurons. It's an organ. You take it out of the person's skull, not to get too graphic, it's a full of mush.
Okay.
Okay, that's the brain.
And that sometimes may need some chemical
There's
changes.
a biology behind it. It
Okay.
wasn't always like this, by the way. Psychiatry used to encompass all of it. That's a whole other discussion. It went in a different directions.
That's one flew over the cuckoo's nest days.
To some degree.
Okay.
So psychiatry used to focus a lot on psychology also. But that's when you talk about psychology, you're talking about psychiatry, you're talking primarily nowadays about biology,
Okay.
physical brain. Mind is a whole other thing. The mind is our life experience, how we perceive ourselves in the context of the world around us, expectations, fears, conflicts. That's the mind.
So psychiatry is basically medicine and psychology is perspective.
To some degree.
I know it was
Like I said, psychiatry didn't used to be that way. It's only the last 30 years it's kind of really went the biological route. All psychiatrists used to also be therapists or analysts.
So now a psychiatrist is not that. They just say, okay,
No.
this is what you need from the shelf, and they quit.
Not everyone. Don't get me wrong. I have a large practice, just a therapy practice also. But nowadays you'll hear a lot of
You do both?
psychiatrists. Yes, you'll see a lot of psychiatrists. They'll say they're, psychopharmacologists. They pretty much say that they only deal with the biology of it. Okay.
So I'm saying you'll have a meeting with one person for psychiatry, and it's basically diagnosing medicine, and then the next one will be a psychology meeting, therapy meeting, which will be perspective on how to handle a battle or a challenge.
different approaches to mind and conflict and difficulties in life. Correct.
And all these issues that you mentioned before, from OCD to bipolar to anxiety, depression. Sometimes they require psychiatry, sometimes they require psychology. So how do they know which one?
Correct. It really depends. Some of them are highly biological, okay? And therapy won't help much. Some of them, they really don't need
So
medication.
I'm a person on the street. I have anxiety. Which doctor am I going to?
So it depends on the nature of the anxiety, okay? We can go into more details. For most conditions, I'll be honest with you, people do best when there's a combination. The vast majority of patients that I see, they're coming to me either from a therapist and they're continuing along with the therapy, or they're seeing me for the first time and I may be prescribing something or I may not. And then almost inevitably, I'll be referring them outside to a therapist if I can't see them.
So you're saying a lot of people end up seeing two people?
That's typically, very often we think of, they jive together, that medications have the function or the role to kind of loosen up the symptoms, to make it less intense, because when the symptoms are strong, your brain is just running for its life.
Got it.
Therapy. So we ease up the intensity of it, and then we do great work in therapy. Okay, that's often why therapists will refer to a psychiatrist. It's just too intense. Ease the intensity of it, and then they can really grow therapy.
So again,
eventually,
so what's your advice to a mother? She sees her daughter is 15 years old and she's anxious all the time. She feels like this is not healthy. What should she do?
Okay, so again, not to get too technical, it really means what really is a big difference when you say she's anxious all the time. There's tons that goes into that. Anxious is not just anxious. Is she having panic attacks? Is there self-injurious behavior? Is it just social anxiety? It really is, it's a world.
So I think a big part
of,
I think you're opening up a different part of the issue is that a lot of times when people have the challenge, besides the stigma, I think a big part of the issue that they have is just like, now what? No, I know if I don't feel well, go to Dr. Fariwa. It's simple. We got it. We know what to do. You know what I'm saying? If my tooth hurts, I know to go to the dentist, okay? But here, you just gave me all kinds of different things. I don't even know. Maybe my 15-year-old daughter, I don't have a 15-year-old daughter, by the way, but maybe my 15-year-old daughter has all of the above. Like maybe she has this and that, and say, you want me to go to 4 offices? What do you want me to tell me? Before you go, just what do I do?
Starts with one office.
Where's that? What
Starts? I know. So look, the people who are on the first line, whether it's a rabbi, whether it's parents, whether it's a teacher, okay, so first line starts with they're concerned about the person that's in front of them. They're actually making the first assessment, right?
But they're not qualified to make a deep assessment.
No, not a deep assessment.
Okay.
They're kind of gauging what is the intensity, what's what we call functional impairment. If things are if there's danger associated with it, if it's very, very severe, so typically you're going to be seeing a psychiatrist first, just to make sure, this is not quickly something's escalate very, very quickly. So usually you see a psychiatrist first, but there's many, many times that it's completely appropriate to go see a therapist first. Now, thank God, there's a lot of therapists in the community. There's a lot more access, and that therapist will be doing a full assessment and then decide, should we move this person along to a psychiatrist? Do we need to at all? Maybe we can wait a little while.
So what I'm hearing from you, I don't know if I'm oversimplifying again, what I'm hearing from you is that if the symptoms are very intense, then they should probably go to a psychiatrist first. If the symptoms are more, not mild, but they're difficult, but they're not intense, they're not dangerous, they're not harming others or themselves, then they should start off with psychology.
Oftentimes, it's a decent general rule of thumb. Yes.
Now, is a psychologist, therapist, social worker, are those all synonyms?
So a therapist is a general term for anyone who gives therapy. That can be a psychiatrist.
Got
It
it.
could be a psychologist. It could be a social worker. It could be a mental health counselor.
So therapy is the section in Barnes and Nobles. In that section,
Right.
then a social worker and a psychologist are the same thing?
They have different approaches, but they're both called therapists.
Yeah, but they're both, the social worker guy, psychologist? Is that the same person?
No. Different professionals altogether.
What does a social worker do with a psychologist?
But that's a psychologist goes to all sort of different schooling compared to a social worker. Different schools, sometimes different approaches. Now, they may overlap in what they do. If they both have a private practice, a clinical practice, and they're seeing patients, they can be, in essence, doing the exact same thing. It's possible. Okay, but they may have different trainings and different approaches.
I'm not understanding. 15-year-old daughter, she has mild anxiety. I don't think she needs a psychiatrist. I think she needs something else.
Go to an experienced therapist.
Just find the therapist.
An experienced therapist who deals with adolescents.
Got it. Okay. Okay, good. I think you answered that clear enough.
Okay, ready?
Yes.
All right, so I have question number 3 for you, Rabbi. It says, what is the Torah's perspective on mental health?
Good. So I think that, like we mentioned it before, I think it's important to get to it again. I think a lot of people feel like the Torah cares about real things. The Torah doesn't care about these emotional things. You know, if I steal from you, the Torah is going to tell me to pay you back. If I damage your house, the Torah is going to pay you back. But if I just your feelings, like just feelings, and they're not a big deal. I think that is so false. I don't know. They said ask the question again.
Ask the question again?
Yeah.
Okay. What is the Torah's perspective on mental health? That's what we're covering over here.
So the Torah's perspective on mental health. Again, I think a lot of people feel like that the Torah only cares about things that are real. Like I said, if I damaged you, then the Torah says pay for the damage. If I steal, pay for the stealing. But emotional things and feelings are not that real. So I just want to use one example that's famous from Masechet Bava Kama, where the Gemara talks about that. If I hurt a person, physically hurt a person, break his arm. The Gemara says there's 5 different things I have to pay for. Now, Nezek is damage. Shevet is the amount of business that he lost. And Ripui is the amount that it costs for medicine. But then there are 2 other things I have to pay for. Tsar, which is just the pain, and Boshet, which is the embarrassment. Which means the Torah considers that a real thing too. That means the embarrassment or whatever, the emotions that I'm feeling also matter. And even the Torah quantifies it almost with a monetary compensation that the Gemara is elaborate ways on how you figure that out. But those things are real and emotions are real. And our Torah, if you damage someone physically, there's a payment. But the Gemara famously says, there's no chilek in olam haba, which means someone who embarrasses someone else in public has no portion of the world to come, which means if you cause someone emotional damage, it's worse than physical damage. Everyone who says sticks and stones will break my bones, but words will never harm me, that whoever made up that phrase is lost. They have no idea that sticks and stones, I can handle my bones. But words hurt a lot. So to make this point, I think it's very important to realize this. The Torah values physical challenges, and the Torah very much values and it brings tremendous importance to emotional challenges too. So to think that the Torah doesn't care, it's not important, you shouldn't fix yourself. What are you talking about? Like I said, what are you talking about? And you say, oh, but my rabbi, your father's rabbi may have been in the time of 1960s with One Flew Over the Cuckoo's Nest, where they were saying, no, you don't need to go to a psychiatrist who is only for a very extreme issue. But now people have emotional issues, and it's my feeling that the pain of the emotional issues are much greater today, partly because our lives are better.
People tell me all the time, I'll take physical pain anytime over emotional pain. And people who I know have gone through terrible physical pain. They'll say, I'll take that physical pain anytime over what I'm going through. And it just occurred to me, and I'm not a rabbi, but I know that the positive commandment of the Torah to take care of yourself.
Right.
Right.
Very good.
How do you take care of your nefesh? What does Torah mean? Take care of your nefesh. That's our essence. It's our being.
Very good.
Hashem says, I'm commanded.
By the way, I love that. I'm
thought about it a second.
It doesn't say, it should have said the gufechem. The answer is that nefesh is a combination of the two. Oh, that's great.
Yeah.
Oh, we like that.
No,
I think that there's truth to that. I think it's great. In fact, I was talking to someone this week who has an emotional challenge and they're going for therapy. And I said, I want you to know, it's a bigger mitzvah for you to go to that therapy than it is for your friend to wake up 5 a.m. to go to a class and to go to learn every day. You don't know what kind of mitzvah it is to help yourself. Because when you're wholer and you're more peaceful and you're happier, you become a better husband, a better wife, a better father, a better mitzvah doer, a better learner, a better businessman, a better provider. Everything changes. So to get stuck on these claims, they're just excuses. From Emunah, Yetzer Hara, the Torah does acknowledge that the old days, all of those things are just excuses to cover up the fact that you don't have the courage and the guts to go deal with it. And you're seeing, and I'm sure you're seeing even in the last 20 years, more and more people from very Torah backgrounds are recognizing the importance of this.
Oh, for sure.
And why not? Like, just to me, you have a challenge. Why not? Why not?
I get more and more calls when I speak with rabbis on the phone about they're well versed.
Yes.
The Bahurim, the rabbis themselves, this is the world.
It's funny, one rabbi of a high level yeshiva in the community, I was talking to her that I said, you thought you were going to open this yeshiva and you're just going to give shiur all day. Like that's what it's about. You're going to prepare the Rashba, Tosafot, the Rashi. I said, you had no idea. He says, Rabbi, you have no idea how much other stuff of caring about the students and being there for the students. Like even schools need to change their mentality. And I think they are, but they need to keep doing that and realizing that the mental health of the students is as big a responsibility for the teacher and the rabbi as is the content of the class. And maybe it wasn't that way 30 years ago. I don't know if it should have been or not, but today it needs to be. So this rabbi was really a smart, intelligent, great learning background. All of a sudden had to become an expert in how to understand people that are victims of certain abuse and people with mental health challenges and how it's affecting their dating and their learning. So that's where we are today. And I think it's important, that's part of the reason why we're doing this, is so that people are clear at the intensity and the importance of this.
I hope we do bring in awareness. It's how we take care of each other.
Yes.
We can't overlook this. People are struggling, they're suffering, and there's no reason for it. It's there, the access is there. It's really time to tear down.
Right, and go.
Of stigma. It's done. It's over with.
Right.
We need to take care of each other.
Okay, so here I have a question that almost sounds like it's worded by a mother herself.
Oh, wonderful.
As a mommy, what's the first step? I think we almost asked this question before, but as a mommy, what is the first step when I notice my child is expressing risky behaviors? My mom says Dr. Fariba. There you go. Doctor got 2 plugs. My friend says child evaluation. My husband says we need a therapist. What is the first step? So you basically answered it before by judging the intensity and then going for therapy.
Well, I'll tell you, but really the first step really is speaking to your child. Parents have to have the courage. They can't get overwhelmed and get overly frightened because your child is relying upon you to be the first line to help take care of them. So the first step is for the parent to actually speak to the child, to do their best to try to get a sense of what's going on, how long it's been going on for, what the triggers are. Can there be things in the environment that can be changed, whether it's school, bullies, whether it's friends, whether it's too much access to social media. There's so many things that a parent can do and should do before they jump on the phone. Of course, if there's dangerous behavior going on, that's a jump. Then you jump. It's true. You do whatever you can to stabilize it, make sure everything stays safe. But day to day, I think parents need to be able to speak to their children more. Now, if they do and they get some sense of what's going on, and sometimes it's difficult, sometimes the child, the best you can, they won't talk to you about it, depending upon their age and the nature of the relationship. But that really should be the first step, is open lines of communication with your children. You should set the stage even in their earlier years. After that, then if it's, again, like you mentioned, we mentioned before, depending upon the severity, most severe, emergency room. Beneath that, reach out to a psychiatrist. Beneath that, a therapist. But sometimes it's really, when you're not sure, find a mental health professional that can see the person the quickest. When you're talking about any sort of self-injurious behavior, get them in the door. Right. Let there be an assessment. Make sure nothing else is going on that the child's not playing. You know how often the parent thinks they know what's going on? It's a totally different story. When the door closes, you're just in there with that adolescent or that adult, totally different story. So get them in the office, and start the process of helping the person.
Right. I just, to your point of parents, and I keep obsessing on this tonight because I think they're the first line of defense. I had a student in Adhd who said to me, my mother and my father took my brother out for dinner. And this was her phrase. I wouldn't use this phrase. And I don't know why they're doing that. It's so not a bold thing to do. That's what she said. And again, I wouldn't use that phrase. But I said, what do you even mean by that? I said, what are you talking about? I said, I took each one of my kids out for lunch or dinner over the last month individually. And when you sit with them individually, you find out more details of what's happening in class and with their teachers and with their friends and what's on their mind. And then you start to share with them your own vulnerabilities. I think that's a critical component. I think parents need to show their children that they're vulnerable, that they have fears, that they made mistakes. Like this notion, I have parents come to me, I don't know what's going on with my son. And I'm like, Rochi, when you were a kid, I remember you were crazy. Now you're surprised that your son cut a class. Like, why are you getting all shocked? So let them know that, because you all of a sudden start learning in the morning, but and now you think you're some holy rabbi and you can't believe your son ever made a mistake. So your children need to know that, even as you grow, that there are a lot of people that you're vulnerable, that you made mistakes, that you have background, that you have fears, that you have things that are on your mind, because then they feel comfortable to share theirs. So parents need to, I don't care the size of the family, I don't care if you have 13 kids or one. You need to spend some individual time with your child, where you're talking to them, where you're opening up to them, they're opening up to you, and that they feel that comfort level. And then you start to see what's on their mind, and then you could know to find all those addresses.
Yeah, so there's a lot of situations where I'll have a parent and a child that have gone through the same thing, either simultaneously or at different stages of life.
Right.
And it's a drastic difference. The outcome of that child, they have a parent, sometimes the parent shares with them exactly what they went through. And they say, yeah, I saw this therapist, or I took these medications, right? It makes the process so much easier for that child. They don't feel alone. They don't feel like there's something wrong with them. They just get help and get better.
Right.
Versus many, many times, and sometimes it's shocking to me, the parent will not mention a word about what they went through. They themselves are embarrassed. And the child is sitting there in anguish. And if they would just know, and sometimes
it's frustrating.
I want to shake the parents.
Yes.
Tell your kid what you went through.
Because some
You're
parents
human.
have this
He's a
mentality.
human.
Parents have a mentality that I have to be the right role model for my child, and a role model is someone that they look up to that's flawless. And that's a mistake. That's a mistake. Our Torah goes out of the way to show different things that great people did, that, again, obviously on their level. But the Torah goes out of its way to show us some great things and then some things that maybe they shouldn't have done. And again, Chas v'Shalom to make it like their mistakes, our mistakes. But the point is, why does the Torah make sure that we know that Moshe Rabbeinu hit the rock? And again, it's completely his level. Why does it want us to know it? Because it wants us to know that there's a concept of being great and having mistakes embedded and part of that greatness. So even though we're not on this, it's not compatible, but it's understanding that concept exists of mistakes even within greatness. And so I think a parent who thinks I have to be flawless to my son or my daughter's mistake, you have to think I need to be a good person, and I want to show them the role model being a good person. Mistakes or fears and anxiety and issues is not a contradiction.
Mm-hmm. Yeah, I think it's easing up on the younger generation. In other words, you'll see kids, high school, college, much more open with it, and they're comfortable with it, speaking about it even to their peers and friends. But there's still a gap now, I think
between the parents,
where it still actually makes this whole situation
right
more difficult, and they have to kind of get past it and get over it and just focus on the well-being of your child. And I think that it'll facilitate.
Right. Okay. I think
so. Rabbi and doctor, I am blown away by what I've heard tonight. I'm enlightened and validated at the same time. Rena and I are dealing with these issues day to day, week after week, month after month, the challenges that our community members are facing. And you really hit the target for us, and you're really helping drive home the message that we're trying to give to the community. We want everybody to know you are not alone. We at this age are there to help. We have a dedicated and fully confidential call line with an expert waiting to receive your call. 718-787-1300. Last year, we provided more than 1,800 referrals by utilizing our database of close to 1,000 private clinicians in New York and New Jersey. We have access to more than 250 mental health resources in our area. This is all supplemented by our very own clinic on McDonald Avenue. Last year, we provided more than 16,000 sessions. More than half of those were for teenagers and younger. Brings the point home that the doctor made. We are helping to address life challenges at the very earliest stages. Again, our call number is 718-787-1300. We're waiting for your call. Thank you and have a good evening.
Thank you.
Thank you. very
Doctor,
much.
thank you very much. It was an honor to do this together, and I hope if anyone has helped from this, and Ronnie, thank you what you said. If anyone has helped from this, anyone has the courage to inspire their family members, inspire their children, their friends to go and do something about it, their life could be so much better than they ever imagined.
I agree. I think it's something that we need to be able to speak about more openly.
Yes.
And I think it's part of, we have so many Chesed organizations. We go out of our way to take care of each other. And I think this is one big area that we need to focus on more. It's part of taking care of each other.
Agreed.
It really is.
Like you said, Nafshat Echem. Thank you very much.
Thank you.
Thank you
Good night.
very much.